Welcome to another episode of Gwen's Pillbox, and today I would like to give you a couple visuals to help you understand a little bit better NSAIDs and how the serious side effects of NSAIDs happen. So NSAIDs are our non-steroidal anti-inflammatory drugs. That's your ibuprofen, naproxen, and aspirin, and I believe there are a couple other too, just to boot. So that's your major ones. So NSAIDs, if you look in your Davis Drug Guide, they inhibit prostaglandin synthesis, the making of prostaglandins. So what is all that about? Well, first we have to do just a little bit of chemistry. Let me explain something to you, but we're not going to go way into it, so just relax. You got this, okay? So we have enzymes in our body, COX-1 and COX-2. They do a lot of things on our body. They combine and they make a chemical called prostaglandins. When prostaglandins happen, we have pain, we have inflammation, and we have fever. So does it make sense that the pharmaceutical companies would target prostaglandins when we're going to control pain? So our NSAIDs inhibit COX-1, COX-2, they inhibit prostaglandin synthesis to help control pain. NSAIDs are used for mild to moderate pain, okay? So what do prostaglandins do in our bodies? What good things do they do? Well, one thing, COX-1 has to do with platelet aggregation, platelets sticking together. Platelets are like starfish. They stick together, okay? And when you give aspirin, that's a COX-1 inhibitor, these platelets don't stick together as readily. So the chance of having a blood clot is decreased. And of course, this is really beneficial for patients with cardiovascular disease, patients at risk for cardiovascular disease, patients that have had strokes. So aspirin are COX-1 inhibitors, okay? Another job of these chemicals, COX-1 protects our stomach mucosa. It has to build that lining up, that mucosa up, that protects our stomach. If we give NSAIDs, prostaglandin synthesis inhibitors, COX-1, COX-2 inhibitors, we decrease the body's ability to protect the stomach. So one of the very serious side effects of NSAIDs is GI bleed. Of course, gastric upset, but we have GI bleed and we can have ulcers from these NSAIDs, and it's because we've removed this protective capability. Another thing that prostaglandins do, actually COX-2 is in the cells within the vessels. They help prevent arteriosclerosis, which is hardening and stiffening of the vessels, and then they get clogged. So again, the serious side effect of NSAIDs is cardiovascular damage, and that's because of this COX-2 inhibition. Lastly, when we're talking about prostaglandins, prostaglandins have a profound effect on the kidney. I made a model here, not a very good one, but I made a model of a nephron, and remember their nephrons are the working units of the kidney, okay? So I'll bring this a little bit closer. In the nephron, we have the afferent arteriole, we have the glomerulus, we have the efferent arteriole, we have the Bowman's capsule, which I consider that kind of like a strainer, we have the tubule, collecting duct, and then we have urine at the inside, the outside there, right? Okay? So if you notice, the afferent and the efferent are different sizes. I believe the different sizes of these vessels have to do, they help create the pressure and the kidney's ability to filter, which was one of its main jobs. So let's give a prostaglandin inhibitor. Prostaglandin is responsible for this vasodilation of this vessel. So we give an NSAID, a prostaglandin inhibitor. We inhibit the body's ability to keep this vasodilated. If this gets smaller, we're going to damage the kidney. We're going to cut down on the kidney's ability for filtration. We're going to impair renal blood flow. So that's how NSAIDs damage kidneys, okay? So recap, here we go. Prostaglandins and our NSAIDs. So serious side effects are GI bleed, well, GI upset, GI bleed and ulcers, cardiovascular damage, and kidney damage. I hope that helps you remember. I'll see you next time in Gwen's Pillbox.